Well, welcome to another episode of the podcast. We have a guest today. We are going to be talking about treating weight from sort of the family perspective. If you have a child that maybe is struggling with their weight, what are some of the newer guidelines? There were new guidelines that came out from the American Academy of Pediatrics earlier this year. So we're going to touch on that. Touch on how you can work on things as a family, how you can frame some of your lifestyle choices that, maybe you want to make sure your kids understand why you're doing what you're doing. We're going to talk about all of these things today. So if you have kids in your life, this episode is for you. Joining me today is one of my colleagues here in Colorado, Dr. Abby Bleistein. She is the founder and medical director of an obesity medicine practice called Healthful Life MD here in Golden, Colorado. So we're basically neighbors. And she has a multidisciplinary approach with a certified nutritionist, a registered dietitian, a certified trainer, specialist in psychology, sleep disorder, trauma, eating disorders, and a chef specializing in culinary nutrition. So when we talk about comprehensive care, like Dr. Bleistein is the person. She does it all through her clinic. And she supports patients with compassionate, comprehensive, coordinated care to focus on a healthier lifestyle. She is board certified in internal medicine, pediatrics, and a diplomate of the American Board of Obesity Medicine. So every time I read my guests' bios, I feel like a little like, whoa, you guys do a lot. So thank you so much for joining us today, Dr. Bleistein. How are you doing?
I'm doing great. Thank you so much for having me.
Well, let's start off with a little bit of why do you do this? Why do you treat adults? Why do you treat children? Why is this something that became part of your medical practice?
Yeah, so it's interesting and kind of listening to some of the other docs who've been on before, I think it was sort of a similar path, but a little bit of disillusionment in primary care. So, I practiced primary care for about 15 years before I started thinking, there's a bit of a values mismatch here. I really wanted to help patients with wellness, but I was just being pushed to see more and more patients with less and less time. And it just became difficult to kind of care for patients. And I am fortunate to have a good friend who practiced obesity medicine. And he said, come watch what I do. And I really just was amazed because he got to spend time with his patients and he really made a difference. And I just feel like we have so many diseases, what I call diseases of nutrition, right? We have so many diseases related to lifestyle, and fitness and metabolic diseases increasing and all of these things that I find if I can spend some time with patients and I know how to treat appropriately, I actually can make much bigger impact on their health, how they live, and they just, live better. So I actually went and got certified in obesity medicine. I went to that conference that spring after I was feeling like, oh, I got to do something, and got board certified, and just was really excited about the science of medicine for the first time in a long time. So I just really, learning about nutrition and metabolic health and fitness and all of those things, how they all kind of go together, was just so fascinating. And I brought it back to my patients in primary care, but found that really, in order to help patients, I wanted to do a comprehensive approach. And that's what made me start my practice. So
awesome. Yeah, I think there is so much overlap for why most of us do this, because we see we can do more for our patients, but we can't do it in that traditional, 15-minute slot that most people have in a regular primary care clinic. So if you feel like your doctor is not, being thorough, it's because they're probably in a system where they really can't be. And so luckily there are a lot of us who are starting to figure that out and are realizing that we have to do things different ways to really help our patients' health, and that it's not just one thing, right? We can't just recommend one diet or moving more or even just start a medication. We really have to do all of these comprehensively to make an impact.
Yeah.
That is a perfect segue to talk about new pediatric guidelines. So a couple of months ago, this is May 2023 when we're recording this, so early 2023, the American Academy of Pediatrics put out this really comprehensive, very long 70-page document about treating obesity in children. And they really hadn't had updated guidelines on this in a really long time.
I think the previous one was 2010 or something.
Yeah, so it's 2010, so a while ago. A lot has changed in that time period. And a lot of it was really common things that we talk about all the time, all the lifestyle things, right? Working on nutrition, increasing movement, comprehensive care, treating all the things that go along with weight gain that can happen even for children, right? Children can get high blood pressure, children can get fatty liver, children can get diabetes, right? So we are treating all these things along with it. But there were two things that I keep getting questions about that were a little controversial, I guess, to the general public, which were a recommendation that when appropriate, we should treat children 12 and up with medications. And we should also be considering surgery for children as well. So what do you think of the guidelines? What do you think of those things? What are your impressions? What can we take from the new AAP guidelines for children?
Yeah. And so I think it's interesting because here in this, 70-page document, like you're talking about, that really had some very important, significant things. The things that came out were the few paragraphs or the couple of pages that were on medications and on surgery. And it ignored all of these other things that I think were also really valuable. And, just like we were saying just a minute ago, when we're treating patients, every patient is different. Every patient is really individual, and what's going on, the constellation of things that are going on that led to their overweight or led to their obesity is really unique to each patient in many ways. And I think that the guideline does sort of, it does approach that, it's talking about that, because what it says is, this is a chronic medical disease that really deserves to be treated as such, right? And so what does that mean? It means that this could be a problem that's lifelong, and it's multifactorial, meaning genetics and epigenetics and food environment and, work and family culture around food and trauma and, all of these things actually go into what a patient's weight or person's weight. And so I think it's really important to recognize that in these guidelines it really talks about that. And it also talks a lot about weight bias and weight stigma. And when we're talking about kids, it's such an important issue to really think about, that weight bias impacts kids, and it impacts their quality of life. It impacts their experience at school. There's a lot of bullying that goes on. And unfortunately, while there's a lot of bullying that goes on, actually the most common bullies happen to be, their coaches or teachers, and then their parents, and oftentimes their physicians. And so I think it's important that we recognize that as well. Where are we at with our own weight stigma and weight bias issues? And so that is in there. And I think it's important to think about those things. But really what everybody's wondering about is, what about surgery and why are they doing it? And this really did cause kind of an uproar. I think it's important to recognize that what it says is not every kid needs surgery. Right. And it doesn't even say every kid with severe obesity, needs surgery. What it says is, for some kids, we really may consider this. And I think that's not inappropriate, but I think we also want to be aware of some of the issues, around surgery, right? So if you look at the articles that they used to make this recommendation, what they show is, long-term success with surgery. About 50% of kids around 5 years will have regained their weight. And so that's, that to me is really something we should think about, because we're talking about, doing a procedure that has lasting changes for the rest of the patient's life. And about half of those kids will still be struggling after the procedure. And so, I think they're working on trying to figure out which kids will end up being more successful with it or having better outcomes with it, and which kids it's not a great treatment for. And so we have to kind of keep our eyes open for that research as it kind of comes along. And the other thing that's really important to remember too is that in most of these studies, about 66% in one study of kids were not taking their supplements after these kind of malabsorptive procedures within a year.
Within a year of follow-up, right? When you get these surgeries, you have to take multivitamins essentially lifelong because you're not as good at absorbing them. And so you can't necessarily get enough from your food. You're also eating less. And so we can have these long-term, sometimes vitamin deficiencies can be really, really severe. They can cause huge medical problems. And so whether you're an adult or your child, if you're getting surgery, we need to know that you are going to keep taking the medication, not the medication, sorry, the vitamins lifelong, or you can really get yourself into trouble. So, right.
So nutritional deficiency can be a big issue.
What I'm hearing is just like for adults, it's not something, any surgery we don't want to do lightly, right?
Yes.
We want to make sure that we understand the risks and that we're prepared to be successful after that. And again, I think the big highlight from the document is not saying that this is the first step or that all children at a certain weight need this. It's just acknowledging that for some kids, it might be the best option. I had a kid I saw early on in my career when I was still a resident, and I'd been seeing her dad. And so he asked if I could see his daughter. She was, I think, maybe 14 at the time. And when I got her history, she had been struggling with her weight, just like her father, since she was really, really little, a young kid. And they had tried everything. They had done every nutrition program. They had seen all sorts of specialists. She'd even been on like sort of a reality TV show for her weight. Yeah, like she had done all the things. And I remember getting the history, and I knew her dad's history, and I just thought, this kid's just going to need surgery someday, right? Like she, like she's done all the things. They know what to do. Her weight is a medical problem. It's clearly a chronic condition. She needs a stronger intervention than what she's had. And she did end up getting surgery before she went off to college, but we did struggle with getting her to take her vitamins. And, but it really dramatically changed her health. And so I, when I saw these guidelines, I thought of her, and I remember this was again early in my practice of obesity medicine. I was still a resident, and I knew, my scientific knowledge at that point was some kids need this treatment, right?
Yes. Yeah.
I mean, every kid does. We're not going to use it for most kids, but when we see that kid who they've already struggled for 10 years, they're getting sicker, why are we not using some of the technology we have?
Yeah, no, and I think that's really true. And I would say the other caveat, which we've talked about before, is just, we should be looking for some of these kids, looking to see who is appropriate. And the kids, we should be checking kids for disordered eating and eating disorders. And the reality is a lot of kids are sub-threshold, meaning they don't meet how we define it specifically, but they have disordered eating behavior. And it's not uncommon in kids and kids who carry extra weight, kids with obesity, that they do have some kind of disordered eating pattern or eating disorders, and binge eating disorder in particular. And as many as 30% of kids who would see a doctor like myself for weight loss could have binge eating disorder. And so, it's something that we really want to pay attention to, because surgery would not be appropriate for those kids. That's not the treatment for those kids. And so really recognizing that, thinking about it, getting that kind of support, and making sure your doctor is asking those questions, or that you're kind of paying attention and asking those questions, because, that would lead to not a great outcome for surgery. That wouldn't be appropriate.
I have a podcast episode, a recent one, where we talk about binge eating disorder, mostly from the standpoint of adults. But I think great to dive into, because I definitely grew up in the generation that was very concerned about restrictive eating disorders, really started to see that with a lot of kids and teenagers in my generation. That became a really big thing. And so I think people are a little bit familiar with, say, like anorexia, but aren't always familiar with what other eating disorders can look like. And I do think that's also been a challenge that came out with some of these new guidelines, is how do we protect our kids from developing eating disorders when we do interventions around their weight or talk about weight? And how do we look for those eating disorders? So as a parent, what might someone be looking for, or want to make sure that their child is getting access to make sure we're preventing eating disorders or looking for those?
Yeah, yeah. So some of the things that you might look for in kids, if kids are hiding their eating or hiding food, you might be concerned about it. So sometimes you might find that there's food stashed away in drawers and things like that. Or you may find that kids just are not comfortable eating in front of you or eating in front of other people. So that would kind of clue you in if there are rapid weight changes. So if you have a kiddo who's kind of gaining weight very quickly or losing weight very quickly, you want to think about what's going on. And so you may have a kiddo who doesn't carry extra weight, and yet their weight is dropping very quickly. And that would be worrisome because there may be some significant restriction going on and some other behaviors that you would worry about. So looking at things like that, could kind of clue you in that maybe something's going on, right?
Yeah.
And a lot of these kiddos have some mood issues going on and things. So you might notice some, signs of depression or feeling blue and really isolation and isolating themselves.
So when we talk with kids about
Mm-hmm.
weight, when a doctor or their clinician is introducing this idea to them or having this conversation with a parent, how should we talk about this with our kids if we have a kid who's struggling, who has this disease, who has this medical problem, and we want to try to help treat it? How do we
Mm-hmm.
talk about it with the kid in such a way that it doesn't make them feel bad or make them
Mm-hmm.
feel bullied or set them up for an eating disorder? What's the best way to have that conversation?
Yeah. And the truth is, I don't really ever talk about body shape and size, right? Because that's not what's important. What I really care about is the child's health. So, what's going on with their health? And so, really, I focus on things like nutrition and sleep and activity. And, do you have friends? What kinds of things do you do with your time? So really focusing on the overall health of the child is how I approach it. So I'll ask them about their nutrition. Tell me what do you eat for breakfast? What do you have for lunch? What do you have for dinner? What do you like to snack on? What kinds of things do you like to drink? And I really don't talk about body shape and size with kids, because what we're really looking at are what are the habits that are going to really help you to live your best life and your healthiest life. And so
I love
that's
that.
how
Yeah,
I do the
yeah. So
focus.
like we don't need to add, because I think in the next decade, I don't know what the time period will be, we're going to change how we diagnose and treat obesity, right?
Mm-hmm.
We're not going to just make it about BMI or a certain
Mm-hmm.
number. We're really going to start to say, is this weight affecting your health? And we're really going to approach it more from like a metabolic health sort of standpoint, right?
Yeah.
Because sometimes we'll see people who have 100 extra pounds or more, and like their blood work looks great, they feel fine, like there's nothing that scary going on. And then sometimes I have patients who they really only have like 20 extra pounds on a BMI chart, maybe not even that, and
Mm-hmm.
they have diabetes and high blood pressure and all these things. And so metabolically, they're a lot less healthy than someone who maybe weighs a lot more than them. And so I think
Mm-hmm.
when we view it through health, right,
Yeah.
is this stuff affecting your health? Well, then let's focus on that, right? Is there nutrition
Yeah.
that makes more sense for you? Do you need to do more movement or a different type of movement? And setting our kids up to focus on their health long term. I like to normalize it a lot when I talk to kids and adults, but like with
Mm-hmm.
exercise, I still use that, like, what is it, the 5-2-1-0, right? Like,
Yeah. Yeah.
you should have 5 servings of fruits and vegetables
Yes.
a
Yeah.
day.
Mm-hmm.
You should have less than 2 hours of screen time, 1 hour of like activity, and zero sweet beverages, right? Like that's like my
Mm-hmm.
go-to initial counseling with all kiddos. And I think that it normalizes, right? Like
Mm-hmm.
all of us should be moving an
Yeah.
hour a day, and you're a kid. So let's get that habit started now instead of trying to do that when you're 25, 35, or 65, right? So I
Yeah.
like to really like normalize, like getting good sleep is important for everyone. Getting
Mm-hmm.
the movement's important for everyone.
Yeah, yeah. And I like to talk to kids and their parents about what should we have more of, right? So if I'm talking about nutrition, hey, I think we need more protein. I don't think you're getting enough protein. How does that look at breakfast? What kinds of foods do you like to eat? What do you enjoy? And then how can we get protein into breakfast? How can we get it into lunch? What does that look like for you? And I think you can really start to tease out, what is kind of the family culture around food, and how do we increase protein around that family culture, right? Or how do we increase vegetables? And so I love to ask kids, what vegetables do you like? And I like carrots. That's about it, or whatever. And it's interesting because I started asking my adult patients that as well.
Yeah.
And you'd be surprised how many adults cannot name 5 vegetables they like, right?
I
And
wouldn't
so
be surprised, but yes, yeah, right.
so that's what I ask kids. I was like, can you name 5 vegetables that you like to eat? And if they can't name 5, I say, every time mom or dad goes shopping, I want you to go with them and pick out one new vegetable you're willing to try. And next time I see you, I want to know what 5 vegetables you're eating.
Yeah.
Right. And so we start to sort of explore, how can we do more of something rather than taking it away?
I
Right.
love it. Yes, I think that's
Yeah.
so huge. Yeah, I think that like the getting the kid involved in trying something new. And sometimes we have to help our kids understand that the first time you try something, you may not like it that much, right?
Yeah.
My kids like carrots. That's I think a
Hmm.
popular one, but they had not wanted to eat cooked carrots. And
Hmm.
finally my daughter tried cooked carrots a few times and now she likes them. And she's
Yes. Yeah.
very funny that she didn't like them before. And I think we have to like emphasize, like, sometimes the first time you try something, you may not like it. So like try a bite. And if you don't like it, that's okay. But maybe we could try it again sometimes, because sometimes we just don't like something the first time we try it, and that's
Yeah.
okay.
Yeah. Well, and I would say too, when my cooking classes, we did a class with vegetables where we prepared the vegetables in 3 different ways so they could try it in different ways. So for example, we took beets and we did raw beets and we did roasted beets and we did steamed beets. And then they could try each one and see what they liked. And the texture is different, the flavor is different. The one that really surprised me was radishes, because radishes to me are a little peppery and they're a little sharp and maybe not my favorite. And we roasted them. And I can't tell you, it was so delicious. Like, I just have never had anything so good. So so trying in different ways and experimenting with kids that way, I think, is really helpful. And I always tell both my kids and adults, I say, what, we crave what we eat most often. So initially you may not really enjoy it, but the more you eat, the more you're going to really enjoy it. I promise you, that's going to happen. And
I've not seen any scientific data on that, but I will say that's my experience when I go
uh,
on a vacation or something and I don't eat as much vegetables as normal. Like, I'm getting on the plane to go home and I'm like, I cannot wait to have a big salad. Like, I'm
like, I
like in
need a
my head,
salad.
I'm like,
Yeah.
there's going to be bell peppers and carrots and olives. And I'm like already thinking about this big salad that I'm going to make
Yeah.
for dinner when I get home. So
Yeah.
I think
What?
that's true. We get used to our habits, and when we start shifting them,
Yeah.
most of the time we start craving those foods. That's what we're used to. It becomes our new normal.
Yeah.
Okay, so that's a great segue, because I wanted to talk about like, how can parents frame their health choices for their kids? So a little bit of like
Mhm.
a different direction, but I think
Yeah.
most my listeners are someone who are trying to improve their health, maybe lose weight or maintain weight. And sometimes that means having really intentional meals, right? So
Mhm.
they may be eating different meals than their family. They may be modifying what they're eating. Maybe they're not eating a meal sometimes and they're eating a meal replacement instead. Maybe their kids are having breakfast, they're having a protein shake or a bar instead. So when parents are making really intentional choices about their nutrition that's maybe different than their kids, maybe their kids are also struggling with weight, maybe their kids are not struggling with weight, and they just want their kids to be kids and eat a wide mixture of foods. How can parents explain what they're doing without sort of contributing to any sort of weight bias for their kids, or eating disorders, or bad relationship with food for their kids?
Yeah, yeah. So, there's a lot there, right? There's a lot to unpack there. And so the first thing that I would say is, we need, as parents and adults, to be very careful about how we talk about body shape and size when we're in earshot of our kids. And I think of it a little bit like secondhand smoke. right? That
Mm.
this is a little toxic, and your kids may be running around and playing when you're talking to your friend or you're talking on the phone, but they hear what you're saying and they really pay attention. And so if you're saying, oh, I wish my hips were smaller, or I wish I didn't have this belly, or I'm going to stop eating, or I'm going to do this or that, they notice. Or if you comment on other people's body shape and
Yes,
size
yes,
in front
that's
of
a
your
huge
children,
one. Yes.
they notice, right? They notice these things, and we really have to be so careful about that. And the self-deprecation that we kind of do naturally as parents, it's terrible role modeling, right? We need to role model better behavior. And so if your friend says, you look fabulous today, you need to say thank you when you're around your kids, for sure, right? You should do it in general because it's better for your health if you do. But the reality is, when you're around your kids, for sure, let's not turn away compliments. Oh no, I look huge in this. I don't look good. I look old. I look this. I look that. Get
Own
that
it.
out
Say
of
thank
your,
you, right? If someone gives
say
you a
thank you.
compliment, say
Yes.
thank you.
Say thank you. And it's okay. You're allowed to accept those compliments, right?
But
And
I
the
think
truth is,
that
it's
that's so
better for
huge.
your health.
Like the first step is like before we even talk about, the lifestyle things is let's focus on health and let's not talk negatively about our bodies around our
Mhm.
children, and let's not talk negatively about other people's bodies. I was
Yeah.
really proud as a parent that my son made it to kindergarten without knowing the F word. I
Uh-huh.
don't think he knows any of the F words, but particularly the word fat, which is not a
Uh,
word that I use to describe people.
yeah.
And he came home midway through the year and used that word about a
Mhm.
classmate. And we had a conversation that that's
Yeah.
not a word that we use, and that people's bodies are different shapes. And it doesn't mean that people can't do things. It doesn't mean anything. And so I think we have to have these conversations with our kids, both for themselves and for how they treat other people.
Yeah, absolutely. I think that's so good. And I think when you hear it, to have that conversation and say, we don't really talk negatively about people's, identity, about their body shape and size, because, and similarly about race and about these things, in ways that can really be, that are just detrimental moving
And
forward.
sometimes there's other people in our circle. I hear this from my patients a lot, that they are in a place with this, right? Like
Mhm.
they are all about body positivity and body neutrality, and they're about health, but that perhaps they have a family member, a grandparent, who is not sort of on board with that. And I
Yeah.
kind of have to give them permission. Like it's okay to shut that person down and say, "Hey, I need to talk to you. Like we're not going to talk negatively about our bodies in my house, and we're not going to use disparaging words or talk about other people's bodies in the house. Like
Yeah.
we don't do that in this household, and we have to
Yeah.
like protect our whole household from that."
Yeah. And I think it's okay, even in earshot, when it happens, because you're role modeling good behavior, right? And
Yeah.
just set that good boundary and just say, hey, we don't talk about body shape and size in that way. That's really not okay. Right. And
Yeah.
just say,
Okay. So
okay,
we've talked about like not adding to
yes.
like the bias about weight,
Mhm.
making this about health, not kind of talking down about ourselves or others, which is
Yeah.
fantastic advice. How
Mhm.
about in terms of sort of like, again, if a parent is making a different nutrition choice, how do they kind of explain that to their kid? Like,
Yeah.
why they're maybe not eating the bread that everyone else is eating, or why they're having a protein bar for breakfast?
Yeah. And so I would say, first of all, one of when you're eating healthy, right? Everything you're eating is healthy for everyone. It's not just not, I mean, not shakes and bars aside, but whole food nutrition in general. If you're making healthy choices, there's no reason that your kids and your family can't eat those things. And it's going to be better for everyone if we start role modeling good behavior. I shouldn't say good behavior, but these positive behaviors around, healthy eating and healthy food. But that being said, you may choose that, oh, I don't think I'm going to have the potatoes today, or I'm not going to have the bread, right? But the other kids are, and the other people in your family are, and so you're serving it in that way. And so I think it's really important not to stigmatize any food, right? There's no good food, there's no bad food, it's food, right? It's just food. And so you may, especially if they notice, you might say, I notice I don't feel as good when I eat potatoes. And
Yes, I
so
like it.
I'm
Yep.
really sticking to this other stuff, right? I notice I have more energy when I eat this. And so that's what I'm doing, right? And
Well,
so
good.
you
That's
might,
what I do. So I'm going to take that as
yeah.
your advice. But that's what I I often don't eat bread because
Mhm.
we don't feel great when I
Yeah.
eat bread. And so
Mhm.
like last time we had hot dogs for dinner, like I eat normal food. And my kids were like, Mommy, how come you don't have a bun? And I was like, they don't make me feel good. Like I don't
Yeah.
want to eat one. It's not a good fit for my body. But like we're not saying like you shouldn't eat one, right?
Yeah.
Like, if
Yeah.
you start, so I think that that's really powerful to be like, this is what my body needs. Or sometimes if you're just not hungry, right? Like sometimes they're having a snack and you're like, I'm not hungry right now. I think this is a trap for moms all the time. They eat whenever their kids are eating, just being
Mhm.
like, my body's not hungry right now. My body's telling me it doesn't need food right now. So
Yeah.
I'll sit with you while you eat, but
Uh-huh.
my body's saying it doesn't need any right now.
Yeah, yeah. And I think that's a great way to approach it. And I think similarly, around the shakes and things like that, it's similar. Just this is what my body needs right now. So that's what I'm having. A lot of my patients who have young kids will choose to do what we call partial meal replacement. So they'll do meal replacements during the day, but the evening meal, they'll have whole food nutrition with their kids. And that makes it a little bit easier around that so that they can role model those behaviors. And I
And
think
we
that's
have
a
good
really
data around
reasonable
eating dinner
option.
together as a family, right? Like that's
Yes,
a good healthy
absolutely.
habit for
Mhm.
both just family like dynamics and like
Yeah,
mental health, but also for health around food, right? That family
yeah,
dinner time, those family meals are something we try to encourage as much as possible for families to do.
yeah, yeah. So I think, for those adults who are feeling like, oh, that might be a good plan for me, but you might think about that. Like if I have kids, maybe I do want to have that meal
Yeah.
as a family meal together, and I can do whole food for that, for that time
Like you
period.
said, your kids are watching too. And so that's a
Yeah,
challenge I
yeah,
see for, a lot of my patients have kids or grandkids in the home. And, like you don't want to be eating a protein bar for dinner when everyone else is having a meal. Number one, it can
yeah,
be uncomfortable and unfun for you as the adult to begin with.
yeah,
But
yep,
it also like it starts like your kids will remember it. I have kids who come and they can remember every diet that their mom did as a kid. Right? Oh,
yes,
she did this and she did that. And sometimes she tried to get me to do
yes.
it too. And again, focusing on health, like what our bodies need.
Yep.
I like to use the word mixture. I have little kids.
Mhm.
My kids are 4 and 7. And so I use the word mixture a lot because
Mhm.
I think my kids would eat nothing but like milk, chocolate, and fruit and maybe occasionally like some meat if
Yeah.
left to their own devices. And so I always just talk about like eating a mixture of food too. Like, yeah, we can have that. We can have ice cream. We can have cake. We can have whatever. We need a good mixture. That doesn't have all the things our body needs in it. So, like, we also need vegetables because it has special ingredients that make our body grow. We need protein. It has special ingredients that makes our body grow. Like, these foods are literally what our bodies are made out of, and so we need to give it the right mixture. So that's some of the language
Mhm.
I use. Other
Yeah.
language or ways that you discuss it for whole families?
I mean, I think that's a great way to do it, sort of talking about it as, so you're not labeling a food as good or bad, but you're talking about, we need a variety of foods, and these are the foods that help our bodies to grow or move or that kind of thing. And the other thing is, too, to just talk about foods more about the texture and the flavor and those kinds of things rather than this is good for you and this is not good for
Yeah,
you.
like what do
We
we
can
like
just talk
about it,
about,
right? Is it kind of
yeah.
fun that it's crunchy?
Yes,
Um,
exactly. Or like, carrots are sweet and they're orange, and boy, you taste them in your mouth. And then you can kind of compare and say, oh, what other orange vegetables? This is different from that butternut squash. That butternut squash, when we cooked it, was soft, but it's sweet that way too, isn't it? And so, and letting them play with that in their mouth and really
and that fits
understand
with
it.
some of
So,
the mindful eating. I have a podcast episode
mhm,
about mindful eating, and that's like a
yeah,
good habit for life too, right? It's like
yeah, yeah,
paying attention to the food, pausing and really enjoying different dynamics, even like the smell and the appearance of food instead of just like eating really quickly and not being that aware of it. So that sounds like a
yeah,
great way to kind of help our kids with those habits
yeah.
too. My
And
kids
they,
also seem to be like interested in different foods when we talk about animals eating them. So like
mhm,
when we've been to the zoo and they see animals eating like cantaloupe and honeydew and vegetables, I feel like that has also been something that has been like eye opening for them
yeah,
too, right?
yeah,
Like this is
yeah,
like okay, like the gorilla's eating salad, that's kind of cool. So I don't know, maybe a trip to the zoo,
yes, yeah,
if we want to look at what our bodies need, right? Like
yeah, Yeah.
what their bodies need too. So again, I have littler kids.
Yeah, no, but I think it says start early, right? So we want to think about it. But if you're already at a point where it hasn't started, I think, introducing kids to cooking and the idea of cooking their own food and making their own meals early and continuing it along, I think is such a great way to get kids to eat healthy because then they have ownership in what they're doing.
Yes.
And they really,
Okay,
if
yes,
they
I
made
love
their
that.
own
That's
lunch,
a
they're
great point,
much
the
more
kids
likely to
cooking.
eat
So
it.
I actually always
Mhm.
say I'm kind of blessed that I learned to cook when I was 10 because my
Yeah,
mom was pregnant. She was super sick. She really couldn't make dinner. And so I learned how to cook for my
yeah,
sister and myself. And I think that that was like a huge blessing because I think a lot of times we don't think about teaching our kids to cook. And so I will
yeah,
sometimes encourage my parents to do that when they're trying to improve health for the whole family, but they don't maybe have time to make dinner 7 nights a week. I'm like, how old are your kids? And they're like
yeah,
12, 14. I'm like,
yeah,
they each get to make dinner one night a week. Like, let's figure out what their
exactly.
thing can be that they can make that they like. And then they have ownership in it. They're probably going to eat it if they make
Yeah.
it. And then that's one night a week that is off
Mhm.
your table as the parent to make. So I like that strategy for like, maybe 10, 12 plus, depending on your kid, like get them, they can make probably a whole meal at that
Yeah.
age,
Oh,
right?
absolutely. I mean, kids at 8 to 10 can make scrambled eggs, right?
Oh,
So you
totally.
can observe them and teach them safety around the stove, and they can actually do it. I had a stool for my kids, so they'd hop up on the stool and they'd be all ready to go. They can make their own lunches at that age for sure, and even younger, sandwiches and vegetables and things like that. So I think start introducing them to that idea early. Even toddlers, you can start with things like cutting up a bunch of vegetables and letting them mix it themselves, right? I love doing those rice paper wraps. And so you could julienne and cut up the vegetables yourself, but then let them put it in the bowl and mix it with their
Are you
hands and
talking
the
about like a
texture.
spring roll?
Yeah, like a spring
Oh, that's
roll.
a great idea.
Yeah. And
Okay,
so
I
you
like
have
it.
lots of different, so you can have purple, you could do purple cabbage, you could have beets, you could have jicama and carrots and snap peas and all kinds of things that you can kind of cut up for them separately. But then it has all the colors. So imagine your 3 or 5-year-old being able to put the bowls in a big bowl and with their hands get in there and feel it and the texture and then wrap it up in a roll that they get to eat themselves. And so
Love it.
things like that where they can play with the texture, where they learn to enjoy the colors and stuff. And so you can start that super young. And then as they're getting older, start to introduce these other concepts because kids even like at 5 could take a butter knife or like a plastic knife and start cutting up soft fruits and vegetables. And so they can start to participate with you and learn how to do this. And you can teach them the safety skills. Let's not put our fingers underneath the blade. Let's hold the knife in this way and really teach them how to do that kind of stuff. And how do you hand a knife, to someone in a safe way? And so you can teach them safety skills with a knife that's not unsafe, but they can start making their own stuff and participating with you. And all of that, I noticed with my own kids that when they took cooking classes, they started eating much healthier.
Yeah.
And so it was really interesting that they
Well,
started
sometimes it's
doing
cool
this.
when
And
someone
they,
else introduces you to the food
yeah,
too, right? Like when your parents are like,
yes,
try a snap pea, you're like, but like when in cooking class, it's snap pea.
yes.
It's a lot more
Like,
exciting.
yep, and all the other kids are trying it. So, okay, I guess I need to try it too. And then they realize, wow, this is maybe my favorite thing ever, right?
I remember in first grade, we like tried seaweed as some sort of project. Like I don't
Yes.
think like ever that would have been something my family would have bought. That's not something we eat. And like I was on this seaweed kick as like a 6-year-old, you
Yeah.
know? So like again, like introducing these things. And sometimes that's out of the home too, to get introduced to these new things.
Yeah. Well, and the other thing to
Okay.
remember too as parents, along those lines is that don't assume because you don't like something that your kids won't like
Yep.
it,
Oh, yep.
right?
I hate
Because I think,
cucumbers. Okay. Like I don't know who hates them. I don't like them. And my son is like one of his main vegetables. I'm like, whatever. That's I
yeah.
will always have cucumbers in the house because he loves them.
Yes. And so remember to introduce your kids to things, even if you don't like them, because they really may love them. Right. And so
Yep.
I think it's so important to kind of do that. My kids went through a stage, they were not little, they were, probably over 5, but they liked frozen peas frozen.
Oh
And
my
it was
gosh.
like Dippin' Dots or something. I don't know, but they loved it. And so I would give them frozen, I'd give it to them in a little bowl and they'd snack on it. I can't say that I would enjoy eating frozen peas frozen, but they loved it. And so it's like, okay, that's fine. Have some frozen beans.
That's so funny. I love it.
Yeah.
I think a lot of this is figuring out what works. Okay. I'm going to toss one other thing out that's been working really well for my kids recently, which is, and this is like, I feel like a trendy thing too, with like charcuterie boards, but making like just a big snack tray. So a lot of times on the weekend, instead of making like a whole lunch, I just, I have this thing that has like 5 different compartments, and I toss like olives, pickles, baby carrots, fruit, maybe some crackers, some nuts on there. I just grab a bunch of whatever we have, good mixture of food, good rainbow of colors. And I just like let them snack on it over the course of like, half hour, an hour, and like it all disappears. And I think that like having that choice is really helpful. And I don't know who eats what, but all I know is like a bunch of vegetables and fruit just disappeared. It was super easy for me. And like, I was like, great, I know that you got some fruits and veggies in. So,
and kids love that. So I think just providing that, having it visually, they're easy to access, and kids will eat it for sure. I think, that's such a good point.
Cool. I want to highlight one thing you said earlier that I feel like we didn't really dive into, which is that this needs to be the whole household. And one of the challenges I've had when I've tried to see kids specifically for weight when I'm not treating their parents is sort of like, well, like everyone else in the household likes the ice cream, so we don't want to get rid of it. Or, everyone else, the littler kid needs the goldfish crackers or whatever, so we don't want to get rid of them. And I think that that's like sometimes setting ourselves up as adults for failure, right? If there are foods that we have just for our kids, maybe we're not trying to make any specific change for our kids, or maybe one kid needs a specific change. And it's so much easier and more fair if the whole household is just making these healthy choices, right? If one person in the house is not eating ice cream for their health, well, maybe like everyone could also not eat ice cream. It's not like a food any of us need. It's not essential to our well-being, right? So I don't know if you have thoughts on that, but that's just something I've seen that I think just makes everyone's life harder when we're trying to, get healthy.
Yeah. And I think, I think it's really tough when we have different, body shapes and size in a household, and that, I agree with you. I don't think it's reasonable to expect one child to eat in a certain way when nobody around them is eating in that way. It just is not okay.
Right. We can't say like you have to eat all veggies and protein for dinner and everyone else gets, chips and tortillas, right? Like,
exactly. Yeah. And the reality is, even if you don't gain weight from those foods, they're not necessarily healthy for you to be eating all the time. Right. And so I think, it comes back to kind of that idea that food is either punishment or reward. And I don't want to punish my other children but you're not punishing them to say, we don't eat ice cream all the time. We eat a mixture of stuff, and ice cream is not an all the time kind of thing. And it's really okay to not have that in the house, and to say, this is how, we're doing this as a family. We're all trying to get healthier as a family. And so really trying to provide healthy things for everyone in the house to choose, and not making one child feel singled out for, having to have these choices. And, we talked earlier about not everyone who carries extra weight has metabolic disease or has consequences from it. And the reality is about 40% of people who have what seems to be a normal weight have metabolic disease.
Yep.
Right. And so that's what I mean when I'm talking about diseases of nutrition and stuff, that just because you don't put on extra weight with it doesn't mean that it's healthy for you. And we've seen that, both of us in practice. We all should move
more, right? We should all watch how much sugar we're intaking. We should all eat, a good mixture of food and get our veggies in, right? Like, for everyone's health, regardless of what is externally visible, it is having an impact on all of our bodies.
Yeah. Yep, that's exactly right. So I think it's healthy for everyone to make these changes, and it's not reasonable to expect, one person in the household to make changes and nobody else makes changes. And the same thing, if you're yourself making healthy lifestyle changes, it is not a bad thing to be having healthy foods and healthy meals for your family, right? You're actually giving them a gift.
And it can impact them, right? If you're now having vegetables every day with dinner, great. Like, hopefully the whole family is incorporating that change, right?
Yeah. And imagine how that's going to serve
anymore.
them.
Great. Hopefully that trickles in the whole family is deciding not to have these sweetened beverages anymore.
Yes, that's exactly right. Yeah.
Awesome. Thank you so much for being my guest. I think we covered so much, and I think this is really important because I think, it's not why I'm a family doctor is because I didn't want to just have an impact on one person. I want to affect whole families. And so I think these are really important considerations for our families. Any final thoughts? Anything that we didn't cover that you want to make sure we cover before we wrap up?
I think we covered a lot of stuff.
Okay, we
so
did.
certainly we can come back and talk about
we only
more.
have a few bullet points to talk about on this episode. I was like, all right, we are covering all our time here. So, well, thank you all so much for joining us today. Dr. Abby, if people want to reach out to you, like how can they get in contact with you if they're looking for someone who offers what you do? Where can they find you?
So they can find me on my website. I think you're posting it in the chat or something. So it's Healthful Life MD. And actually, if you can actually schedule a phone consultation, a free phone consultation with me, if you're interested in talking to see if we're a good fit or see how I might be able to support you with your healthy changes. So I'd love to talk with you.
Well, thank you so much for joining us. That stuff will be in the show notes. And until next week, take care.
Thank you. Take care. Bye-bye.
Thank you for listening to the Dr. Francavilla Show, where we learn about all things related to weight and health. If you love this podcast, make sure to leave those 5-star reviews and share this podcast with a friend or loved one. If you have a topic about weight and health you want me to tackle, head over to the website, thedrfrancavillashow.com to submit your question. And make sure to subscribe to the podcast so you don't miss next week's episode. Take care.